Like every routine, applying Latisse is all about consistency and precision. I ensure my face is clean, makeup and contact lenses are removed, and any other facial care products have already been applied. I remove an applicator from the tray and I hold it horizontally like so. Then I place 1 drop of Latisse on the area closest to the tip, but not directly on the tip. I draw the applicator along the skin of the eyelid margin where my eyelashes meet the skin. Then, I use a tissue or a cotton pad to blot any excess solution beyond the eyelid. Once I'm done, I throw away the applicator, grab a new one, and I repeat the same process on my other eye. It's that simple.
Latisse solution is a prescription treatment for hypotrichosis, inadequate or not enough lashes to grow eyelashes longer, fuller, and darker. If you are using or have used prescription products for eye pressure problems, use Latisse under close doctor care. Latisse use may cause increased brown pigmentation of the colored part of the eye, which is likely to be permanent. Eyelid skin darkening may occur, which may be reversible. Only apply at the base of the upper eyelashes. Do not apply to the lower eyelid. Hair growth may occur in other skin areas that Latisse solution frequently touches. If you experience eye problems or have eye surgery, consult your doctor immediately about continued use of Latisse. The most common side effects after using Latisse solution are itchy eyes and/or eye redness. If discontinued, lashes will gradually return to their previous appearance. For more information on Latisse, please see the prescribing information.